Welcome to the Summit Independent Insurance Podcast. I'm here with the founder and owner of Summit Independent Insurance, Tim Coughlin. Today, we're going to be talking about Medicare supplement misconceptions and the things that keep people from changing their Medicare supplements. We've been seeing rate increases across the board on Medicare supplements, and people's have been paying record amounts for their Medicare supplements. Now, you could save money by changing your plan, but misconceptions hold people back. Tim, I'm glad to have you here today, and I am hoping that we can go into some of these misconceptions and how people can avoid making these mistakes and hopefully save some money.
Yeah, it's frustrating. I was talking to a couple and their premium, they're on a closed plan, but they both have pre-existing conditions and he's just turned 82 and she's 78. We looked at the rates and we were able to lower the rate by 359 a month, and which
Wow.
was huge. And what people don't realize, there's several things that people don't realize. And I'm here in Northern California, and we have the birthday rule here. So that's a very clutch tool for a Medicare supplement independent broker like myself. We've been saving people a lot of money. We just had a client yesterday, and we were able to save her $76 a month. We could have saved her more, but she doesn't, if she had lived with somebody, we could have gotten her an additional 12%, which would have put the savings at about $100 a month. But what I see, and this is natural, people, when they're older, they have, pre-existing conditions, they're getting services, maybe they've had some major services, and they're very fearful of losing their coverage or changing their coverage, of losing their plan, losing their doctors. So all of that is natural. But there are some misconceptions that people have that prevent them from changing that are unnecessary. One of the first things to understand is that Medicare supplements are standardized. The three most popular plans are Plan F, Plan G, and Plan N. Let's say you want to change plans and you want to keep your Plan F, which a lot of people do, even though I don't think it's always the best choice. But they want to keep their Plan F. Well, any carrier that offers a Plan F is going to have the same identical core medical benefits as any other Plan F.
Mhm.
So if they do have pre-existing conditions, but we're able to use the birthday rule where they don't answer health questions, they could keep a Plan F, but have a lower premium. There's no specific carrier network with Medicare supplements. It's all the same for any Medicare supplement. You could see any doctor or provider who accepts Medicare anywhere in the country. They get the same medical benefits, choice of doctors. The service is good with all major carriers in our experience, and they might be paying, well, 359 a month less for a couple. They both happen to be in their birthday rule periods. One was March, one was April. They could get the same plan. And you can still keep your Plan F. If you were eligible to buy a Plan F and you don't want to give up your Plan F, then you can keep your Plan F because you're grandfathered in. Again, I don't necessarily think it's the best choice, but a lot of people can afford it, particularly if we keep their rate lower. They can move easily to a different Plan F. They think they're going to lose their doctors, but there's no specific network of providers that's different from one Medicare supplement carrier to another. Really, it's Medicare calling the shots with the supplements. Medicare is a national program. Over 90% of doctors, by most accounts, accept original Medicare, so they'll accept your supplement. Now, some doctors aren't taking new Medicare patients, but that's a separate issue. People think they have to wait until open enrollment in the fall. And that's kind of a dangerous misconception because they think they can change in the fall, right? They can't. And that's not open enrollment. The annual enrollment period or annual election period is not, it doesn't have anything to do with Medicare supplements. It's for Part D prescription drug plans and Medicare Advantage plans. Sometimes when people are new to Medicare, they think, oh, I can just join a Medicare supplement during the annual enrollment period. And that's not true either. So that's a common misconception. The other thing I would say is that people think that if they give up their plan F and they move to a plan G or a plan N, that the coverage is going to be way worse. And it really isn't. Like plan G is almost identical to plan F. It just doesn't pay the Part B deductible, which is $257 for 2025. In most cases, people have already met that deductible, so they wouldn't have to meet it again if they've had services. Plan N is a great plan. It's the lowest premium of the complete plans that, cover all the Part A charges. Does have a few small co-payments and something called excess charges, which is really sounds worse than it really is. So people need to get educated. And I hate to see people paying way more than they need to for their supplements because they're fearful and they have misconceptions.
Yeah, well, I think that's really important, Tim. It helps to work with an independent agent such as yourself that can enlighten people on these misconceptions, walk them through steps to save money with how expensive healthcare is. It's really important to save money where you can and avoid pitfalls. I know you're pressed for time today. Do you have anything else you wanted to mention before we wrap up?
No, you're absolutely right, Jack. The Medicare supplement premiums here in Northern California, where I am, where we have the birthday rule, they've been going up. They're really getting up there. The last couple years have been above average rate increases, and this year was particularly bad. People don't need to overpay for their Medicare supplements in California. Even if they wait till their birthday rule period, they can get significant relief. My personal preference is definitely for Medicare Supplement or Medigap as opposed to Medicare Advantage. I think we may see more people going towards Medicare Advantage this fall in the annual enrollment period. But if people can hang on to those supplements, I encourage them to do that, and we can help lower their premium in most cases.
Thank you so much for your time today.